The baby formula shortage. A second shipment of formula has arrived from overseas with 100,000 pounds of formula that could be in stores as early as this weekend, we're told. Lawmakers on Capitol Hill, as you know, have been grilling federal regulators and baby food companies on their response to this crisis. ABC News senior national policy correspondent Ann Flaherty, as well as ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, join me now with more on this. And you've been doing an incredible job following this hearing and just bringing us up to date on just what's been taking place. The FDA admitting it was too slow to act after this whistleblower had raised concerns about Abbott's Michigan plant. So what happens next?
Well, that's right, Kira. So absolutely stunning revelations from the FDA. They talked about a leaking roof with standing water. They called the conditions at the plant egregious and shocking. So what happens next is Abbott has agreed to take various steps to clean up this mess, and they say that they have already started to do so. They plan to reopen the plant on June 4th and say that the plan is to have more formula on the shelves, safe formula, at the end of June than they did in January.
So, Alok, as a physician, what are your thoughts on this hearing and what we've learned so far, and the fact that, I mean, the FDA needed to be, have its feet held to the fire as well as Abbott?
Absolutely. And Kira, I see like two kind of acute issues that we're going to be following right now. And number one is rebuilding that trust for parents out there wanting to know that in the future, the formula that they give to their babies will not be from a factory that has standing water in a previous citation for poor hand washing, conditions that can absolutely lead to environmental bacteria growing in a dried product such as baby formula, which can lead to devastating infections in young children. But also, we do want to understand why it took so long for the FDA to get this report and process it. And part of the reason that we all, as public health proponents, as physicians, want to know that is when we tell parents out there, you can trust this product, this baby formula, whatever, because it's FDA approved. We also want to be able to tell them that concerns are taken seriously by the FDA. And last but not least, I hope this also sparks a much larger discussion about our availability and accessibility of formulas, and that we have more imported brands here as well, so that we just don't have a monopoly by 4 companies.
Oh, agreed. That discussion already taking place, as you know. And ABC has reported that an investigation actually found that Abbott did not establish a system of quality control, actually, that ensured that the infant formula was safe from contamination. I mean, that's just shocking.
Right. Well, so this is what we know, Kira. We know that 4 children, babies, infants, grew ill after drinking formula from this plant. The FDA gets in, they do their inspection, and they see evidence of this very rare but deadly bacteria that you do not want in a plant. Now, they do sequencing testing on this bacteria, and they can't connect it definitively to these children and to this illnesses. Now, when you talk to the FDA, they say that that doesn't mean that that can be ruled out. It's still a risk. Abbott says, look, there's no conclusive evidence. So I think that what you're going to see are people are going to point toward this lack of quality control. If you still want to be talking about liability here and holding people accountable, that's an important piece.
Yeah, indeed. And Dr. Patel, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.